Hello and welcome. If you or someone you care about is living with dry age-related macular degeneration, there's some really hopeful news on the horizon. We're starting to see new, non-invasive treatments that are changing the conversation around this condition. We're going to break down what these treatments are, how well they've worked in studies, and exactly what you need to know to talk about them with your eye doctor.
For a long time, the approach to managing dry AMD was pretty much a waiting game. Patients were often told to make some lifestyle changes, take certain vitamins, but the main strategy was really just to watch and wait. Well, that's finally beginning to change. We're seeing a really important shift toward more active treatments that are designed to slow the disease down and, in some cases, even improve vision.
Now, before we dive into all the new stuff, let's just do a quick refresher on dry AMD itself. That way, we're all starting from the same place.
So at its core, dry AMD is a slow, gradual loss of your central vision. Your doctor might have talked about drusen. Those are just tiny yellow deposits that build up under the retina. Over time, this can lead to something called geographic atrophy, which is basically where the cells of the retina start to wear out. And until now, our main tools have really been vitamins and just keeping a close eye on things.
Okay, so with that background, let's get into the first of these new proactive treatments. It's a type of light therapy, and the specific device is called the Valeda Light Delivery System. So what is photobiomodulation? The idea behind it is actually pretty simple. This therapy uses very specific colors or wavelengths of light. The light is aimed directly at the cells in your retina to kind of give them an energy boost. The goal is to help those cells work better and hopefully slow down the damage that AMD causes.
In the United States, the FDA has actually authorized the Valeda system to be used for dry AMD. It's based on the results they saw in clinical trials.
So, what did those trials find? Well, in one analysis, an incredible 55%, that's more than half, of the eyes that got the treatment saw a real measurable improvement in their vision. We're talking about gaining the ability to read at least 5 more letters on an eye chart.
And when they looked at the results over a longer period, the average vision gain was almost a full line on that eye chart. There was also some evidence suggesting that the treatment might help slow down the disease from progressing to its more advanced stages, like geographic atrophy. Now, it is so important to have a clear and balanced picture here. While these results are definitely promising, it's not a silver bullet. Some studies found that the benefits didn't last forever or that they weren't sustained past 6 months for some people. The research is still ongoing to figure out who it helps the most and for how long. Light therapy is one really exciting new path, but it's not the only one. Researchers are also looking into a completely different method called microcurrent stimulation.
So instead of light, this therapy uses incredibly small, low-level electrical currents. It's totally non-invasive. The current is just applied right through your closed eyelid. The goal, though, is pretty similar, to gently stimulate those retinal cells and get them working better.
So you can see we have two very different ways of approaching the same problem. One uses light energy, and the other uses tiny electrical currents. So where do things stand with microcurrent therapy? Well, the early results are definitely encouraging, but it's important to understand that many of the studies so far have been pretty small, and larger clinical trials are still underway to really confirm how safe and effective it is. The big takeaway is that light therapy with the Valeda system is already authorized by the FDA, which means it's available. Microcurrent therapy, on the other hand, is still considered investigational and is in that research phase. So, one is here now, and the other is hopefully on its way.
And what about safety? That's always a huge question. Well, the good news from the trials is that for both of these therapies, the side effects have been generally mild and they don't last long. We're talking about things like a little bit of eye or skin irritation or some temporary discomfort.
So who are these treatments really for? Well, the research so far strongly suggests that they work best for people who are in the early to intermediate stages of dry AMD. For those with more advanced disease, unfortunately, the benefits are not as clear, and that's a really important thing to discuss with your doctor.
The most important thing you can do now is take this information and use it to have a really good, informed conversation with your doctor.
The big question to think about now is, could one of these new treatments be a part of your future care plan? And the best way to answer that is to start that conversation with your specialist.